Prepare live stream. I'm also going, this is awesome. Record them. Okay, so it says that the meeting is being live streamed and Zoom has told me that it is not. So we're also going to record this. Hello, Hannah Myers.
Hi.
BCHIP. We never know what's going to happen here on these calls. How are you this morning?
I'm good. How are you doing, Jennifer?
Good. So, as y'all know, I am a consultant working with BCHIP and trying to spread the word on exactly what they do over there at the offices. So, Hannah, why don't you introduce yourself first and explain a little bit about what you do with immunizations?
Absolutely. So I'm Hannah Myers. I'm the Public Health Program Manager here at BCHIP. And I run all the stuff that are for the Bucks County Immunization Coalition. So we are a small team of 5 that I run. I specifically run the homebound program, so people who can't get vaccines. I will do either COVID, shingles, RSV, or flu. Someone will come to your house and they'll do those for you. It can be anyone ages 3 and older. So if you're interested in that, we do that program. We also do clinics all over the county. So if you're interested in that, you can always reach out to me for clinics.
So I've often asked this question, so I think other people will probably have it. What qualifies you to get a homebound vaccine? I mean, I'm not one that really likes to leave my home, but I can. So I understand that I probably wouldn't qualify just for being a hermit. But why don't you go ahead and tell us what you guys serve?
So normally we get it from somebody who either has a case manager or has somebody that is a caretaker. So typically these patients can't leave the home, or if they can, it's really, really difficult for them to get somewhere, whether they're handicapped or legally blind, things like that, where they really just can't get out of their house to get a vaccine, and their doctors aren't the ones that are going to give it to them.
Oh, okay. And so when you say case manager, what kind of case manager is that?
It really depends. To be honest, we do not screen for that. We kind of just say that if you're a good Samaritan, you're going to tell us the truth. So typically, though, it's either PT or OT, or they have an in-home nurse or someone like that who gives us a call, or sometimes it's a family member.
Oh, okay. And so then your team would go out to their location at agreed upon time and make sure that they're taken care of.
Yep.
Great. And why don't you explain a little bit more about BCIC?
Sure. So the Bucks County Immunization Coalition is run by BCHIP, Area Agency on Aging, PA Polio Network, and then the Department of Health. We meet bi-monthly, and really we're just a group of people who are interested in helping the betterment of Bucks County when it comes to immunizations. And that's for all different levels. We have the 6 hospitals who are part of it. We have all different organizations, and we just come together and meet and really try to discuss the best way to get Bucks County immunized, to be honest.
And so how's it going?
It's going. It's tough to get people immunized right now, and I understand. Flu and COVID season is kind of hopefully coming down, but we still have a ton of different vaccines that aren't flu and COVID that people need to be getting. So we're really trying to push those on top of the other 2.
So what are those?
Well, as you know, what we'll be discussing today, one of them is going to be the measles vaccine. But a big one right now is RSV. We get a ton of people who are interested in the RSV vaccine, and it is a big issue. I mean, for infants, for children, and for older adults. So the RSV vaccine is really huge to talk to your physician about getting.
Okay. And yeah, we want people to be informed consumers. So, talk to your doctor, do your research, talk to BCHIP. There's a lot of places where you can get some great information on vaccine safety.
Yeah.
And that is a big issue today, right? As, my friends over at BCHIP know, like I like to talk about the hard issues. And there's a lot of bad information out there on how vaccines may be unsafe. The best person to talk to is your doctor about that, and then do some research on the web.
It really is. And there's a lot of pharmacists too. If you go to your local pharmacy and ask them questions about vaccines, they will give you all the information that you need. A lot of them are more than happy to talk to you, even if it's for 5 minutes, just about a vaccine that you're interested in. So don't be afraid to go there as well.
That is a really good recommendation. So yeah, let's talk about this thing. What's going on in Philadelphia with the measles? You sent me that article. It was scary.
Yeah. So The good news is the article was scary, but after doing some serious research, I realized that it is less scary than what the news is portraying, which made me pretty happy. The good news is there aren't measles cases in Bucks County. The closest is Philadelphia, and there are 9 total cases in Philadelphia right now as of January 15th.
And is that a
Um,
lot?
So after doing some digging, yes, in Philadelphia, that is a lot. But if we actually go back through the last 4 years, so from 2020 to now 2024, there have been a lot more cases of measles than we've been aware of in the United States.
Oh,
So I found that very interesting because back in 2022, we actually had 121 cases of measles across the United States, according to the CDC. Now, you can go ahead if you want.
yeah, I was just going to say, is that because people were not vaccinating due to COVID?
Yeah, so due to COVID, a lot of people weren't getting their typical vaccines. They couldn't get to doctor's appointments. And so that's the highest in the last 4 years. But I mean, last year we had 58 cases of measles across the United States. The closest was in Pennsylvania. It was not in Philadelphia, and they don't give me the actual locality of it. But there were cases in Pennsylvania and New Jersey. So what I want you to take from this is that while it sounds really scary that we have 9 in Philadelphia, and that is very close to us, measles has been happening for the last 4 years.
Right. I had no idea. And that's, I mean, a lot of people are because there was pushback because of the COVID vaccine. Everybody like seemed to have an opinion that was tied to whatever rather
Yeah,
than science in some cases. So I think that got generalized to a lot of different types of vaccines. And people felt, well, I'm either staying in a lot or a lot of people heard about herd mentality. Now,
exactly.
I'm a statistician by trade. I'm one of those geeky people that loves numbers. Hannah is our expert here in Bucks County on immunizations, and we can tell you that herd immunity as a way to prevent disease is a bad idea.
Yes. And I think that taking from this measles thing as well, you have to remember that it was eradicated as of 2000, but there have always been cases that have come up. Now,
Sure.
we've seen the most in the last 4 years, and that is because of the COVID pandemic. But it certainly has peaked now, and I'm hoping that it's going back down. Now, 9 cases in January, I don't know the monthly breakdown of these. They give you specifics per year. So,
Okay.
so this could be, that might be a lot compared to what it's been in previous years. However, just after doing a little bit of research, I realized that it has been an issue, just not as big of an issue and as close to Bucks County.
Okay. Yeah, I have a family member who I was very young when it happened, but one of my cousins did go through polio. So,
Okay.
and survived, which was really interesting. Had a lot of problems for a couple of years, and then, well, he's doing fine now.
Yeah.
But it can be scary, and a lot of these things are gone. A lot of these diseases, we consider them gone. And then, like you said, there's always a couple of cases out there. And then you hear the media hype, and you're like, oh my gosh, measles is back. And then it starts the uproar all over again.
Yeah. And I will say that according to the CDC as well, if you were born prior to 1957, you do not need the measles vaccine, which I was not aware of. They consider you immune, I guess, because it was so rampant
Yes.
prior to the vaccine that they assumed you either had it or you had some form of immunity to it. But now you need to get the vaccine between 12 and 16 months, and then again between 4 and 6 years. So there are 2 doses of the vaccine.
Yeah, and I just want to say also, because of everything, and one of the wonderful components of BCHIP is that we can dispel a lot of myths. So if parents are concerned, and I never knew this when my kids were younger, because they're all in their 20s now, and it was just kind of they got stabbed at all their appointments, and you just dealt with it, and doctors wouldn't talk to you about it. And there was, the internet was limited back then. It was around, but limited. But parents have a lot of choices now when it comes to how to give vaccines. So if there is concern, if you don't want, multiple, that you can spread them out over a period of time, so you can make multiple appointments if that's what you're more comfortable with. Also, I think that's so important.
I think it's extremely important. And I think that just sometimes the information that we have on the internet, while might be super overwhelming to parents, know that there are certain websites, and one of them that is my absolute favorite is the CHOP website. I just think they have phenomenal data. They always have, parent guides and things like that. Sometimes they even have live chats that you can go in and ask questions to nurses. So I just think, yes, there is an overwhelming amount of data and probably too much that parents can Google, but just know that there are reputable websites that are pretty awesome to use if you're interested.
Yeah, that CHOP one is a great resource. And also just to tell parents, for what I do professionally, I try to get content to rank when people search for it. So it's actually not that hard to get the words vaccine safety, are vaccines safe to rank. So you really need to step beyond whatever it is that shows up on the first screen of Google or that first page and say, well, wait a minute, this is a group in the, some state I've never, or some town I've never heard of. Like, where is this data coming from? And I know
Exactly.
CHOP, my kids were pretty sick when they were younger a couple times, and I trust the people down at CHOP implicitly. I mean, in fact, the one group at CHOP that I love the most are the residents and the interns, because they've been through and they have to read all the research, and they've been through school in the most recent years. So I used to request that more than the doctors. I was like, wait, no, I don't want I want the new kids.
Yep. Nope, I totally agree. I totally agree. And even going back to like the measles topic, I know that people don't love the CDC, but when I'm reading all the articles that are in the news that are CNN and Fox and things like that, and they are way blowing this up to make it seem like we have thousands and thousands of cases in the US. And when you actually take a look at it and you see that, oh, well, this has been happening for at least 4 years, and I could go back further if I wanted to.
Right.
So you really have to do some digging and your research and see, and ask your doctor. I didn't know if I assumed I was vaccinated from it, but I went back and I was like, I should probably look at my records, thinking that my parents would have gotten this, but you never know.
You
So,
don't know.
yeah,
Right. Exactly. And also that's important too. I always make this argument that, the news there, it's all about sound bites. And there's lots of wonderful, fantastic, benefits of having news outlets for sure. I'm not slamming any of them.
no,
But, if they're reporting on the weather, vaccines, some radical group doing something crazy in some weird, location, they can't be experts in everything. So you do
exactly.
need to find, and don't just go with popular opinion because you hear it on the 5 o'clock news. Do your digging. It's your health, your children's health, your family, extended family members. We've done a lot of talking with BCHIP and on their social accounts about vulnerable populations. So you don't want your vulnerable populations to suddenly not vaccinate simply because they heard something.
Exactly. Exactly.
Okay, Hannah, anything else going on in the world of vaccines that we should know about?
No, not that I have. This has been a great conversation. And as always, reach out to me if you have any questions at all. You can also reach out via Facebook. You can reach out via email, our phone number, things like that. They're all over our social media.
Great. Well, Hannah, thanks for being there for our community. BCHIP is here to keep every resident in Bucks County safe and healthy. And they work on behalf of a lot of different initiatives, non-smoking, no smoking, immunizations. The executive director, Kim, who couldn't be with us today, she works with all of the area hospitals, healthcare providers on a regular basis to make sure everybody is talking. And I think that is the critical part of what BCHIP does. Okay, well, we're going to say goodbye to now. I'll put some links in the comments below, and thank you to everybody for joining us today.
Thanks, everyone.